This is a conference on that was called by a grassroots citizens volunteer organization, a cooperation between downwinders around Hanford and physicians, scientists from the Portland area. We call ourselves the Northwest Radiation Health Alliance, and maybe one of our founding members, Pat, would start out by telling what we think is one of the important issues, why we formed ourselves, why there was a need to do this.
I'm Pat Hoover. I'm a Hanford downwinder. And I'd like to say that we have formed because the government has not asked or wanted to ask Hanford downwinders the right questions. Northwest Radiation Health Alliance has. We have questioned on health surveys over 800 members of the affected population exposed to radiation from the Hanford Nuclear Reservation. This is a very unusual collaboration to have scientists, doctors, and lay people study and present a questionnaire to a population. This collaboration has bridged the gap between scientific and lay approaches to environmental health. Our health survey has worked. We found elevated numbers of disease and health problems from this toxic poisoning, and we have the scientists and doctors to tell you about that today. I'd like to have Lois Camp illustrate what we're planning and affect our health.
Thank you, Pat. My name is Lois Camp, and I, a Hanford downwinder, have followed the process of the study and of the emissions and the health effects from the time that the Freedom of Information Act required that the government release those previously secret documents. I don't have a budget like the government departments do and the government programs. I call their material the government glossies. So please bear with me while you see this information, this chart, which I've posted on a gift box to keep it firm and in place. This shows, I think, better than anything I could say, exactly why we take the position that there must be no more studies, no monitoring, nothing funded or done until the right procedures are in place. One of the reasons we object to the process and of the studies and how it was done is shown here. The yellow portion of the graph represents iodine 131. By the way, this is from the government information, from the documents that they made available to us. The pink portion is what they referred to as the minuscule amount of the other radionuclides. This is a list of the radionuclides, their half-life, and the organs that they know were affected. Notice the other radionuclides are all in the pink. Iodine 131 is in the yellow. Iodine 131 has a half-life of 8 days. Theoretically, then, after 8 days, this magnitude is no longer a concern. Then, where we contend we must focus our attention is on the remainder of what they call the other radionuclides, which many of which are still recirculating to this day. We have never been studied, or there's never been any concern or any interest in even addressing the health effects of these other radionuclides. They know and they knew which organs they affected. We contend that everything must stop now, and the affected population be involved from the very first discussions on how any future investigation is done. Thank you. Is there anything else that you'd like?
About 6 years ago, some downwinders came to us feeling that they needed help, they were being ignored, and they were sick. We interviewed about 5 of them, got long, detailed histories, and learned what questions to ask. And these then were put up into a questionnaire which produced the 801 answers which we have entered into our computer database. I just want to say briefly that as a result of the information we obtained, we have 2 peer-reviewed publications in national journals, and a letter was published last month in Epidemiology concerning damage done by radiation. This was medical radiation to women and childbirth and miscarriages. And actually the editor wrote us and said they would like to publish the letter, but would we please comment on their editorial? And we then did add some information disagreeing with their editorial, disagreeing with the standard epidemiologists, and the letter was published last month. Basically, what we learned in our study is that the first publication, that the women who had hypothyroidism, presumably as a result of their exposure to radioiodine, which is the one known radioactive isotope that the government has been telling us about, had twice as many miscarriages as did the women who were also exposed, living in the same areas, and did not have miscarriages. So there obviously was a difference that was what we call significant, in that there was damage to these women. The second publication, which was just published this past week, is a study of 2 populations of downwinders, Hanford downwinders and Chernobyl downwinders, juvenile hypothyroidism in these 2 populations. This was published in Environmental Health Perspectives, which is a journal that is put out by the National Institute of Environmental Health Sciences. Basically, I would stop there and would be happy to answer questions. Well, basically, I would only add that we feel that there is fairly good evidence, scientific evidence, that I-131 is definitely related to our findings, and that therefore the I-131 that we know to have been released from Hanford is probably the causal, etiological, as we say, factor in the development of hypothyroidism. Everybody knows that I-131 produces hypothyroidism. That's accepted in the medical profession and in the scientific world. Hypothyroidism is very rare in juveniles, except that which occurs in the first few months of life because of maternal problems. We had this population, and the 60 that we found was far higher than any studies of the incidence of hypothyroidism in children. It does differ from the Chernobyl population, however, because they studied children 10 years and younger and found increases in hypothyroidism in their children. And of course, they studied children who were exposed to the fallout after 1986, who were young enough then to have been affected. And it is well known that children with smaller thyroid glands, the same small amount of radioiodine that gets into the thyroid is 100 to 1,000 times more damaging, more destructive than it is the same amount of radioiodine to an adult large person with a large gland. So basically, the fact that they both has no control group, primarily because it's very expensive. We didn't have an $18 million.
Was there a control group used on this?
Our study has no control group, primarily because it's very expensive. We didn't have an $18 million grant in which to do work on it, and with the limited resources that we had, we evaluated the 801 questionnaires. When we compared, and it's not a good comparison from an epidemiological point of view, it's not a good comparison to take a group of self-selected responses to questionnaires compared to standard populations, because the population is biased, it's selected, we call it biased because of the self-selection. But when we get rates, incidence, occurrence rates that are 10 times what would be expected in a normal population, we think that raises serious questions as to whether or not there is a probable association.
So the rates, you might have expected to find 6, say.
We might have, we would have, in this small group of people, we would have found 6 or less, yes, because it is a fairly rare disease in childhood and adolescence, unless exposed to some toxin which destroys the thyroid gland.
I know one thing I have read that, X-ray practices that are obsolete now, any idea if those would have contributed at all to this population, or that's still what you would have found?
Well, to some extent, but the study, for instance, that came out of Montreal, to which we responded with a letter to epidemiology, that was published last year in Epidemiology, and they looked at young women who had X-rays of their chest because they had scoliosis, which is a twisting of the spine. And sometimes surgeons attempt to straighten the spine for these women, young women, and that means they get even more X-rays of the chest, so they get more exposure. And they studied a group of such women and found that their X-rays did indeed cause an association or produce an association between miscarriages, increased miscarriages compared to a good control population, which they had, and low birth weights compared to their control population. That was they assumed that was probably scatter, as we call it, X-rays that when they focus on the chest, scattered to the ovary and the uterus, and they were making the hypothesis that the damage to the ovaries or the hypothesis probably, or the ovaries or the uterus, produced the changes that resulted in increased miscarriages and in low birth weights. And we merely wrote the letter saying that our hypothesis would be that X-rays of the chest would certainly hit the thyroid gland, and that the easier explanation for their data would be that they produced hypothyroidism, and that we had shown was associated with increased miscarriages.
I guess my question, not reading the study, is if you took into account that that these might be people at an age who would have had more maybe dental X-rays, that sort of thing, that would have affected when you get the control group of 6, I guess I'm asking if you take that into account, that maybe, I don't know, if you would have expected a little more thyroid disease because of bad x-ray practices.
Well, I'm not sure that dental x-rays are scattered enough to affect the thyroid. Certainly chest x-rays do, x-rays of the stomach and other x-rays. And there aren't many x-ray studies that are done in children and adolescents, really. And certainly I-131 is not used in almost any place in the United States for the treatment of hyperthyroidism in children and young adolescents, probably because of this fact that there is a known association between the development of hypothyroidism, and the thyroid hormone affects every cell in the body, and the unknown factors make it uncertain. Therefore, no endocrinological clinic that I know of uses I-131 in young people. They took children who were born within a fixed interval of 4 or 5 years. That's all they studied. And so they would not have been able to find the children who were born after that who developed hypothyroidism, and so it just doesn't apply. Their study didn't apply to juveniles at all. And they don't make any mention of age definition of when they're hypothyroids. At least I didn't see that data when I read their very voluminous report.
May I add, too, that some of us, such as Laverne Couts and myself, who had been surveying the population, the stable rural population in eastern Washington where we lived, we knew at the very onset that their selected years of study of the births within that time frame would absolutely never establish the true magnitude of even thyroid disease, because for instance, the age group of my mother, who many were in their childbearing years during the 40s and 50s, they weren't included. And yet we knew from discussions with physicians and the pharmacists that the numbers of thyroid cases skyrocketed. But by the very protocol that was chosen in that age group, just addressing the question that you asked, that we knew that it eliminated that very high risk population. Myself as an example, I was born in 1941 and would have been old enough to have been drinking the milk from our cow by 1943 when the worst of the emissions started. But I was not included in the Fred Hutch study because the date of my birth was prior to the selected dates of birth that they chose.
Exactly.
And that, again, clearly prevents documentation of one of the most vulnerable populations.
Say it, but there's no question but what the numbers of hypothyroid patients are very high in our group, much higher than one would expect in any population, except if you go to a medical school and a hypothyroid clinic, you might see that number of people, that percentage of people. And in the HTDS study also, they found an enormous number of hypothyroids. But of course, they divided it in such a way that it did not appear to be related to what they considered their estimated doses. But as I said earlier, I-131 is known to produce hypothyroidism, is accepted throughout the world by the scientific community as producing hypothyroidism. And we feel that the associations that we found in our study certainly fit with the concepts of I-131 exposure, which we know about, and it's the only isotope we really know about from Hanford because we've gotten no significant information about other isotopes. And it does fit the story that it was probably the cause of increased numbers of hypothyroidism.
Dr. Grossman, my name's Tim Connor.
We didn't specifically look to see how many juveniles or how many hypothyroids there were. Pardon me, I'll talk into the mic, you can hear me.
No, go ahead.
We didn't look to see how many hypothyroids there were in juveniles. This was one of the things that turned up and that surprised us when we found first, we weren't even looking for how many hypothyroids we were going to get or how many miscarriages we were going to get. We were looking to see what people were suffering, what they thought they were suffering from. No one knew until 1986 or 88 that I-131 had been released in great quantities during that period. And certainly none of the doctors in the area who treated any of these patients would have thought that I-131 was responsible for the hypothyroidism they were finding. They would find hypothyroidism, they would treat it. And so the answer is, now to be brief, was that we didn't look for that, but we found it.
In the graph that is part of our paper, figure 2, and a better copy, by the way, is on the wall out here to the left with the colored graph. From our limited data, it looks like that the maximum of the reports that we got occurred about 5 years after the maximum release time of 1945, which is also very unusual, a very early onset. And whether that is related or not, I don't know, but remember that the exceedingly high rate of thyroid cancers in the Chernobyl children had also this characteristic of an exceedingly unusual early onset. So this is a contribution that we made that I see no contribution from the Hanford, the official Hanford thyroid disease study. They don't discuss it. They may have some, they could maybe have looked at that, but
Have you looked at their data to see if it might be hidden in their data if they didn't ask?
I'm not willing to spend our what we did. And I will, as a scientist, I will say that the thyroids, the Hutchinson thyroid study is very poor science for one general philosophical reason. As a scientist, you go out and look at phenomena as broadly as you can possibly do. And you don't go in there with preconceived idea to prove this or that. You go in there to see what there is. The Hutchinson thyroid study had only a very narrow focus, and therefore its results are so narrow that they, for the issue that we're discussing here, Northwest Radiation Health Alliance, is totally irrelevant. It only shows that by their choice of their cohort, they didn't find what they thought they might find, namely an association of higher dose with higher rates of hypothyroidism or thyroid disease in this very limited chosen population. They didn't find it. Now, what a true scientist would do before he goes to the New York Times is to sit down and do a long and hard amount of thinking to see, hey, there must be something wrong. Because as Dr. Grossman pointed out, if you go through the medical literature and the epidemiological literature, there's no doubt that iodine-131 produces health effects. To write that there are no health effects is simply stupid. What they should have said is, we get results that we don't understand. And maybe we have to do a little more thinking to come up with an explanation why we find an unexpected result. That is what a scientist would do. The other thing is that in epidemiology, as a prime example of one of the pioneers of epidemiology, Dr. Stewart's work, which was the first work on the effects of X-rays during pregnancy on the subsequent increased risk for childhood cancer. She didn't start that study with any idea about X-rays. She had no idea that X-rays had anything to do with the childhood cancers. She was questioning actually a totally different question. There was an increase, an unexpected increase in leukemias among children, which turned out later not to have really anything to do with the radiation, primarily. And what she did, she went out into all of the health departments in the counties of England and gathered all information that she could possibly get about the mothers of these children that were sick, and about every detail of their infectious diseases, of everything else, and put it together in an enormous database. And only then, when she started to look at this database, did she find that the difference between the children born in the same area, during the same year, that had childhood cancer, and other children that did not have cancer, the only significant difference was that the sick children's mothers had been X-rayed during pregnancy. That was her discovery. The thyroid study goes totally the other way. They go out and they want to show that X-rays to pregnant mothers have no effect. How do we do that?
I'd like to add, because it hasn't been mentioned, that we've been focusing, except for what Dr. Nussbaum just said, we've been focusing on thyroid. Our data suggests that there are many more cancers than there should be in a given population among our group of downwinders. We are still evaluating, and we hope to be able to finish evaluation and report this in a journal. There are other disease problems that have occurred. We are still looking at those disease problems because the downwinders have suffered from many, many kinds of conditions, and we're still trying to evaluate if there seems to be an association, or if there is an association between their downwind exposure and these diseases.
Rudy, you had some 3 points that you were going to speak about.
Yeah, the issue of specifically the studies. What are the important issues affecting downwinders at this point in terms of these questions of their health? Number one is that all of the data that are constantly being quoted by media and by official reviews like the National Academy of Sciences reports, the BEER reports, the National Radiation Council, and so forth, they're all based on research that is funded by the people who created the radiation in the first place. There is no, in this country nor in any other industrialized country, there is no possibility to do any scientific research as an independent group of researchers, truly independent, truly following the pattern that I just described as being a true scientific approach, to look without bias. All of the research, 99.9%, I didn't do the calculation, but I'm pretty sure that's correct, on health effects of radiation have been done by money spent by the Department of Energy or the Department of Defense. That's not independent research, because anybody that is in research know the control by the grant giver over the research and how it is conducted, how it is conceived, the questions to be asked, and the results to be published. So number one, for the benefit, and not only of downwinders, but of people that live in chemical toxic sites and everywhere else, remove the budgetary control over any health surveys, health studies, totally away from those who produce the pollution in the first place. And that can only be done if, right from the very onset of designing a study, the affected populations, whether that be downwinders or people around chemical toxic sites or people in northeast Portland who happen to be mostly black Americans who live around chemical sites that are extremely polluted, when the only way that studies that are really significant and have credibility can be done is with the involvement from the very beginning of representatives of these populations and scientists that carry the credibility and the trust of those same populations. And that has never been done. And that is a number one issue. And before that revolution in how to do health research has been implemented, I can see why Lois Kemp and the other downwinders here would say no more studies, because these studies have been used against the interests of the downwinders, and the interest that is being supported by these studies is the interest of a scientific establishment that feeds on the suffering of these people. There are thousands of careers of scientists and engineers and bureaucrats involved in doing more studies. And that has to stop if we want to get significant change in the value and the credibility of health studies. And one other point that affects downwinders, and again, other populations in the same boat, is that in a civilized and democratic country, it is an outrage that health insurance companies are permitted to refuse to pay for services if there is any suspicion that the illnesses for which they need to be treated are related to radiation. That's an outrage. That's the comparison. And one of the commentaries in the Tri-City Herald was, you get what you pay for. Well, you get silence for $18 million, and you get some questions raised about that silence for 1/1000th of that amount. The other thing is that the whole issue of distinguishing between what the A-bomb study did, and the A-bomb study is still considered the gold standard of epidemiological research on radiation effects. That was external radiation. X-rays are external radiation. The distinction between biologically what radioactivity does when it is lodged inside the body and gets deposited either in the thyroid or in the bones or in the muscle tissue or wherever. The literature, the credible literature on this whole issue of the biological effects of internally lodged isotopes is very meager. It's like comparing a whole library full of data on external radiation. It's enormous. If you look for studies on external radiation, it's enormous. If you look for credible studies on internal isotopes, it's very meager. Now I'm convinced that the Department of Defense and the DOE have classified reports, certainly on animal studies, which are usually done in very, very large doses and therefore are, just on the basis of that, not really very relevant to human beings. But in terms of human beings and in terms of the effects of internal radioactivity on the whole system of the body, not just to one little organ, is virtually at this point still unexplored territory. So instead of raising questions about these unanswered questions, the focus of the money given for health research is to avoid raising the questions. So, and if one agency basically controls what research will be done, because research can only be done if there is support, then you can essentially brainwash the scientific community into a very narrow focus. That's what happened.
There are no good studies on strontium, and strontium we know has been out in the air out of Hanford. We know it goes into bone. It has a long half-life, and we know human beings, downwinders, probably have increased levels of strontium in their bone, but there's no data, no information of any kind. Cesium moves around the body like potassium, which is all over the body. Now, there's some arguments that the potassium doesn't stay as long in the body as strontium stays in the bone. So cesium probably doesn't stay as long in the body, but there's no real data telling us how long some cesium molecules might stay in the muscles or might stay in the heart or wherever it might stay. We just have no data.
I think, Peter, that you need to have Lois address the same question.
The initial question, just as you asked, was addressed by the very first panel that was chosen to decide what do we do with this information that we just discovered that had been previously classified. In a simplification, the answer to that, given to me as a layperson, was that the iodine-131 was the logical radionuclide to study because there was a vast body of information available as to what the health effects were, and that, of course, was initially the biggest volume of our exposures. Had the study been done quickly and properly, even as late as the 80s, I think as a downwinder we could have accepted that. Ideally, that study should have been done in like 1950, when the people were really experiencing the effects of the immediate effects of that exposures or that exposure. But they drugged this study on millions of dollars later, thousands of deaths later. They still toss about that, you know, there's discrepancies. The header study, which was dealing with the emissions, has been in constant contradiction and considered worthless. So the whole process of those studies basically has been a waste of time, even though ideally they I think, were practical in selecting the iodine-131. But it just expanded into this mushroom of mess that is unacceptable to us.
The government scientists have studies that show the effects of many of the radionuclides, and they remain as classified documents that are not being released, no matter how many Freedom of Information Acts we try to put on them to get this information out. There are studies and medical reports done that were done early on in the Manhattan Project that could be very valuable to the doctors, the medical community, and the scientific community, but those are still buried as classified materials. So when Dr. Grossman and Dr. Nussbaum say, We just don't have anything to compare our health survey's results to. It's because we can't get our hands on it. But it's out there, and it needs to be released to the scientific medical community.
I take a little objection to that. Because again, we're talking only about money. It was the fact that this thyroid study, the official thyroid study, only was done now and with a long delay, is a tremendous waste, and again from a scientist's point of view, a tremendous waste of valuable data that in the death of the disappearance of the people that carried a lot of information about the effects of Hanford. By waiting, you lose the basis of your investigation. And I think, whether I want to call it deliberate or whether it is just convenient, you can choose for yourself. But if you don't want to find something, you wait until the evidence is gone. That's the way it is.